Welcome back. September is National Recovery Month. I wish we didn't have to have a National Recovery Month, but some researchers are asking, is fear of opioid withdrawal adding to the crisis? I caught up with a doctor to get insight. Check this out.
News on the opioid use disorder and the overdose deaths continues to be bleak. Last year we lost over 70,000 Americans to opioid overdose. We continue to lose over 200 individuals a day to this brain disease, which is chronic, which is considered a chronic relapsing brain disease. Well,
that's what we're seeing, and it's been talked about too much. And like you said, 70,000 is ridiculous. The high rate of relapse of those in recovery from opioid misuse, we're constantly seeing that. So why is that?
So one of the areas that really deserves a lot more attention is the opioid withdrawal syndrome. It's the acute syndrome that an individual goes through in an attempt to abruptly discontinue opioids. And as you can imagine, the fear of withdrawal continues to drive the abuse and dependence, if you may. And what's exciting is that the FDA has approved the first non-opioid drug to assist with abrupt discontinuation of opioid use. This allows any physician, even a primary care physician, to prescribe this medication and help people get off abruptly. And if you can imagine, the fear of withdrawal actually keeps people from even coming to treatment.
Well, for somebody out there who may be dealing with this right now, talk about some of the symptoms of OWS and why they're so difficult to identify, because somebody out there may have it right now and not realize it.
Yes, that's absolutely true. So what happens is within a few hours of discontinuation of opioids, patients begin to experience nausea, vomiting, runny nose, teary eyes, tachycardia or pounding heart, anxiety, depression, even suicidal thoughts. So the medication that was approved by the FDA, Lucimera, is exactly a medication that addresses these withdrawal symptoms and assists patients to comfortably discontinue opioids.
What's the best way for somebody to address withdrawal?
I would say under the care of a physician, using medications to assist with withdrawal and detoxing safely. The medication I mentioned, actually, a non-opioid, the first FDA-approved non-opioid medication actually allows an individual to abruptly discontinue opioids. And I think that it's really an exciting addition to our field in helping patients enter recovery and maintain abstinence.
Absolutely. It's an important topic. Like you said, those numbers are staggering on how many people are dying each year to this. My hope is that someday we won't need a drug like this to get people off of opioids. Is that yours as well, Doc?
Absolutely. Prevention probably is the first step. But, I think as far as dealing with our current crisis, doing it under the care of a physician, like any other medication, there are some common side effects like lowering blood pressure, dizziness, drowsiness, that sort of thing. And of course, for more information, the individuals should talk to their doctor or go to lucimera.com.